Welcome to today's episode of Strategic Healthcare Marketing Update. I'm Jane Weber-Brubaker, Executive Editor of Plain English Healthcare. As we move out of the pandemic, we're still processing the experience as an industry and trying to understand how best to apply what we learned. Our content this month reflects where we are on that journey. We're moving past the crisis and toward recovery and rejuvenation. So let's take a look at our latest stories right now. This month's update features a rebranding initiative that raised the profile of a healthcare organization that had been hiding in plain sight for more than 30 years. A high-performance ad campaign featuring precious moments shared by parents and formerly sick kids who've been treated successfully. A story about how one West Coast community found a way to share public health information with hard-to-reach and historically underserved communities. Expert guidance from 3 nationally recognized health systems that are leading the way toward health equity, diversity, and inclusion. Insights from senior health system executives who came from outside of healthcare and how they are pushing their organizations forward. And finally, viewpoints from 4 physician CEOs, how they steered their health systems through the pandemic and led vaccination efforts in their communities. Let's take a close-up look at these stories right now. Our first story is a cautionary tale. You may get what you ask for, but it might not be what you actually need. Waco Family Medicine, before it was renamed Waco Family Medicine, thought a new logo would do the trick and unify all of its divisions and clinics that had completely unrelated names. But it wasn't enough. They hired a marketing agency, Pavlov, to create a logo. Let's hear what Scott Kirk, Chief Brand Officer at Pavlov, had to say.
We went to them one day and they were expecting to see more logos. And we said, hey, before we design any more logos, we want to pitch something. We think you should change your name.
Dr. Jackson Griggs, CEO of Waco Family Medicine, had arrived at the same conclusion. Let's hear what he had to say.
They went back and did some more soul searching, and we did the same, and we all kind of came to the same conclusion. But they made the recommendation, which was unequivocal when they came back to us and said, we're not going to be able to create a single logo for all of your organizations and all of your sites without an overarching brand. You need a brand change. Mm-hmm. And that was a moment of kind of enlightenment for the rest of us. We knew that at that point that the work was going to have to happen. We were going to have to just go ahead and grab the bull by the horns and do the work of rebranding.
Take a look at this great before and after story and see what a difference a new brand can make. Our next story features an ad campaign based on patient testimonials. Well, what's so special about that, you might ask? Ross Weatherich, Vice President and Managing Creative Director at Prairie Dog, says testimonial campaigns are around for a reason. They have an ability to tie your product directly to an outcome that shows success. Children's Mercy Kansas City worked with Prairie Dog to develop an ad campaign featuring precious moments shared by parents and formerly sick children who've been treated successfully. Each TV spot begins with 2 words: love will. Love will find answers. Love will push further. And a billboard shows a dad snuggling with his toddler with the message, love will protect these moments. Besides TV and outdoor advertising, the media plan included radio, print, streaming, YouTube, Pandora, Vivo, and social media. Lori Ellison, Senior Vice President and Chief Marketing Officer at Children's Mercy, reports that the campaign exceeded expectations across multiple measures. Check out the article for all the details. Speaking of billboards, our next story makes the case that out-of-home advertising is a great way to reach underserved communities with public health messages. Matthew O'Connor, CEO and founder of AdQuick, says, out-of-home advertising cuts through the digital divide and reaches people of all ages and demographics while they are out and about in their communities. Here's an example. At a crucial time in California, one of the states hit hardest by COVID-19, the Santa Clara County Public Health Department launched a public health campaign across digital billboards and bus shelters. With its hashtag Santa Clara Has It Covered campaign to encourage community members to wear masks, the public health department effectively reached 99% of historically hard-to-reach residents. This included people who are multilingual or low income, as well as those without access to the internet or living and working in rural agricultural communities. This article will give you some great ideas for reaching those hard-to-reach people in your community. Next, we have a story by Marcia Simon, who spoke with leaders from 3 prominent health systems about how their organizations are addressing health equity, diversity, and inclusion. Johns Hopkins Medicine focuses on educating its clinical staff. Karen Jones, the Academic Medical Center's director of the Office of Diversity and Inclusion, says, when confronted about unconscious bias, the biggest pushback is something to the effect of, why are people so sensitive today? It's more that people are speaking up now. They're tired of being offended. Jose Rodriguez, MD, Associate Vice President for Health Equity, Diversity, and Inclusion at the University of Utah School of Medicine, says diversifying the representation at leadership tables is a good start, but not enough. He says, if we invite one qualified underrepresented person to the table, it's better than having none, but it's not where you need to be because one person isn't heard. Hendry Tan, MD, Associate Vice Chancellor for Health Equity, Diversity, and Inclusion at UC Davis Health, says, the health gap between poor and affluent communities can be a difference of 10 or more years in life expectancy. There's a lot of work to be done to reduce health disparities. Read the full article and get guidance on how to move your organization forward. Next up, Jim Samuel interviewed 2 health system marketers who came from outside the industry, one from entertainment and the other from higher education. Kevin Mabbitt, Chief Marketing Officer and Chief Consumer Officer at Intermountain Healthcare, previously led Disney's consumer experience efforts for theme parks, cruise lines, resorts, retail, and digital businesses. Jim Nilsson, Director of Marketing at UC Health, came to healthcare after 14 years leading marketing strategy, digital marketing, and communications at Northern Kentucky University. Both leaders knew that healthcare trailed other industries when it came to embracing digital technology and meeting consumer expectations. Nilsson's first step toward digital transformation at UC Health was revamping the system's websites to better reflect the patient journey. He used data to support his strategy, an approach that resonated well with providers who need evidence to be convinced. Mabbitt thinks it's critical for health systems to become more consumer-focused and embrace digital tools. Some in the industry may think consumers are not ready to adopt digital health. He believes they are not only ready, but very interested. Can healthcare invest in digital health and consumerism and drive business goals? Or are they opposing aims? Read the article for answers. Our last article recaps a webinar featuring 4 health system CEOs and how they steered their organizations through the pandemic. We asked them if their understanding of the role of marketing and communication changed as a result of the pandemic. Here's what they said.
I think it just was, it highlighted their crucial role, especially at a time like this. I think we always knew what they did and how good they were at it. We just didn't know how great they were at it.
It was such a rapid cycle turnover. I totally agree with Steve. And the other thing we forgot is the media, of course. We all were, I'm sure, in front of cameras multiple times a day, actually, because newscasters wanted it. It was a good story, and our marketing communication folks did yeoman's work to coordinate all of those.
Well, our marketing team would remind me, because I was getting a little sick of the microphone and the camera, and reminded me, with this story, if it's not you, somebody is going to do that. And if the reputable health systems and leaders are not the ones doing it, is the message going to be accurate? Will it engender the trust in the public that we need to? I was like, doggone it. All right, you're right. Here I go again.
Happy to. And I think it gave the communications team a moment to shine, because there was a heavy duty responsibility there with a bunch of really short timelines, as John was mentioning, that allowed them to kind of strut their stuff. I can't tell you how many responses I made to things. We like to vet things out with them, but how rapidly they helped turn around statements with me, and how they helped me sound a lot more literate than I might have sounded without them, and I appreciate their help.
So kudos to all of you marketing and communications heroes. What you did helped your organizations through the toughest time any of us can remember. Watch the full webinar and read the recap to hear more. That's all for this month. If you're a member, you can log in right now and view the full articles at strategichcmarketing.com. So be sure and check them out. If you're not a member yet, sign up for a free trial and you'll get access to every article, exclusive members-only webinars, and more. And don't forget, with one membership, you can give up to 9 of your coworkers their own access to all of our digital content. That's less than $3 a month per person. Where else can you train your entire team for that little? So sign up today at strategichcmarketing.com. I'm Jane Weber Brubaker, Executive Editor of Plain English Healthcare. Thanks for joining us for this month's episode.